We've been talking about medical students. There are an awful lot over here. What can you guys do? So I'm pleased to introduce to you from the IFMSA, the International Federation of Medical Students, Roopa Dhatt. Roopa, where are you? Please come on up. And Usman Mushtaq, who's from the Youth Commission on Global Governance for Health, set up by The Lancet. Let's discuss some youth-related issues. So Richard gave us some ideas there on what he thinks medics can do, younger people can do to really set the agenda for themselves. What are you guys doing?
Yeah, so I think Dr. Horan really raised some really great points. I think one of the biggest misconceptions out there is that people see young people as the future and not really the present. But the reality is that we are the present. We represent a huge constituent globally. And one of the things that IFMSA is really trying to do, and I think anyone, not just even in the medical sector, can do, is really challenging our institutions of education. In some places, they're a bit crippling our efforts. They're unwilling to change. They don't want to
challenge in what way?
Well, challenge them in changing the course of the curriculum. So, for example, in medical education, specialization is pushed so much, fragmentization. And here we're talking about multi-sectorial, going across, being more holistic. But how can we develop that framework when education is saying, be focused, be specialized? And oftentimes, global health is called the hippie medicine in medical education. So how are we going to address these multi-sectorial issues?
Is global health actually a mandatory part of a medical student's education?
No.
I mean, I'm genuinely asking.
Yeah.
I have no idea.
No, it's not a mandatory part. I mean, we are seeing successes in certain countries where they're able to create online modules. Medicine UK, which is a member of IFMSA, has done a great deal to put that into the curriculum. But no, it's a challenge. In many countries, it's an optional thing. It's the hippie aspect.
Are you saying it should be?
It should be
an integral part of
course, if we're talking about the development agenda and we're setting, countries are setting how we're going to be approaching issues, global issues, and we want the people that are going to be delivering the care to deliver things in a multi-sectorial way, in a holistic way, how can they have that framework when education is being pushed in a very compartmentalized, fragmented way?
Okay, Roopa, let's put that to the audience then. Well, what do you think? There are many students over here and many medical students here. Should global health, some kind of global health module, be a mandatory part of your education?
Yes.
Okay, and how? Then that's something, in terms of the question we were asking Richard, what's the next step for you? That's something you can be putting pressure to bear on, yes? Just an idea, guys. Usman, what else are you guys doing? Perhaps not within universities, but on a bigger stage to make sure that your voice is heard.
So following up from that, our institutions, specifically medical colleges, are very traditional and very narrow-sighted. So as young people within IFMSA and outside IFMSA, we are also looking at how we can provide a youth lens to the current challenges or to the current political discussions, which we feel are very important.
Like, for instance?
Like, for instance,
you were at Rio Plus 20,
I was
right?
at Rio Plus 20.
Okay, so?
A lot of medical students were at Rio Plus 20. And actually, the frustrating part for us is that the health community at large, we are very inward focused. Like, we don't focus at the other sectors. We preach about it, but it's not happening on the political level.
So were there many other health professionals and medics and
surprisingly few.
Really?
Medical students were one of the few. We were one of the few, and you had people from other health backgrounds as well, but it was very, very limited. There was 50,000 participants in the Rio Plus 20 conference, and very few of them were from health. And even though health was like a big part of the discussion on the future development goals, so it's quite frustrating as young people.
So what's your message then to these kids over here? And those who are maybe, you know, have seen better days, let's put it that way.
I think the message, yeah. The message is very clear and short. Like, as young people, we constitute a very, very big part of the population. We are not mirrored by like short-sighted political gains. We are very selfish, so we think about our future. And that is why it's absolutely necessary that we are engaged in those processes in a meaningful way, both in priority setting, in making the decisions, and in implementing and being the watchdogs and evaluating what we're doing. So
actually turning up is a first step.
Yeah.
Yes.
Looks like there are people who agree with
exactly.
you there. But then how do you go beyond that and make sure that your voice is actually heard?
Yeah, so I think the point is that one, actually having meaningful messages to deliver and using the tools that we have. Social media has connected us to so many different avenues. IFMSA uses that as a main way to say, these are our messages, this is how we collect our messages and deliver them. So using social media, but then also using
but
that.
How do you make sure, I'm sorry to ask an Emperor has no clothes question here, but how do you make sure that when you're using social media and you're on Twitter, that you're not just preaching to the converted? But you're not in a little bubble of people who are all looking for the same themes and, you know, just retweeting the things they agree with.
Yeah, that's where you have to really go to other sectors. So one of the things we're trying to do is, you know, we're going to go to the education consultations. We're going to also go to the ones on environmental, learn a little bit of their dialogue, and sort of have our meetings not just focus on traditional health topics, but about environment, about climate change, about these topics so that we're a little bit more informed, learning about the partners, learning the dialogue. And social media is very much, you have to know what you're tweeting, what hashtags you use, and we sort of build that capacity in our members, and I think that's important for us to engage.
So what are the lessons then? I mean, I really genuinely would like to know, how does one use social media more effectively to progress one's goals?
I think like in terms of like when we specifically discuss the post-2015 and setting the priorities for the post-2015 development agenda, it's not only about like how youth are using the social media, but also how the current system is enabling us to use social media.
Okay.
And we have seen some very, very good examples over the past 2-3 years on how social media has been used to gather not only youth voice, but voices in general. And these kind of systems and input-based systems has to be developed by youth, for youth, and also by and for civil society. So it gives us ownership on the processes that we are participating in.
So there is a very big process going on at the moment, is there not? Heading towards 2015. The updating of the MDGs, the daughter of the MDGs, what will they be with this whole sustainable development goals thing? What are your thoughts on that, and how do you make sure that your voices are part of that process?
Yeah, I think the issue of setting goals and setting agendas, one, the future is going to be ours. So the decisions that are made here, whether they're good ones, hopefully, but if they're bad ones, we're going to be the ones that are going to inherit them and are going to have to deal with them. So it is a priority for us to engage with it. And the way that we try to do it in IFMSA is sort of build the language at the local level so our members understand what are goals, where are they being discussed, but then linking them to the national consultations, trying to get opportunities, whether it is in the UN agencies, but voicing out and bringing the numbers, saying that these are priorities that are important to us. And for IFMSA, it's very much consistent with keeping things universal, so not just focusing on the issues of others, but really saying that the next goals have to be about every country, every person, keeping them measurable, being multi-sectorial, and as well really calling to principles of equity. And sustainable development is very important for us to collaborate with, because one of the things is not just thinking about the now, but really seeing how things will last. So the efforts and commitments we make now need to be for the future. And as systems are changing and the health conditions are changing, especially when we talk about climate change, we're not afraid to engage with that. We don't feel it as a competition, but things that we should really work in synergy together.
And how do you see the interface between climate change and these health issues? Because there are many people, including some in this room, mentioning no names, but very eminent people from the Karolinska Institute, who have some real doubts about whether the climate change agenda should be overlapping with the Millennium Development Goals to give us SDGs.
So, I mean, climate change, I think we just have to acknowledge that it's not that it's something coming in the future, it is present now. And it's impacting not only low and middle income countries, it's also impacting high income countries. It's just that we have the resources to cope with that. And if you look at, like, I think in a health perspective, we got a very good presentation from Professor Johan on it. For us, we have realized that climate change, like when you discuss about sustainable development, climate change is not a part of sustainable development talks. And that is because governments are very reluctant to talk anything about climate change because they cannot agree. And this is very problematic because the UN's climate change negotiations are not leading any way. And we're not talking about it in the Sustainable Development Agenda either, even though it's very strongly linked. So it is very frustrating for us to see the process. We're trying to raise our voices, but we are not heard. And that has
But do you think that health, you're saying that climate change is not part of sustainable development, but is health seen as an issue which is linked to climate change? Because quite honestly, until I started prepping for this conference, I can't say that I'd been reading a great deal about it.
Yeah, so climate change and link to health is a reality, because if we look in the medical field, we're seeing disease patterns change. So if there's a change in weather pattern, it's going to be an increase in prevalence of certain diseases. Example is if we look at the case of Indonesia, there's an increase in rainfall season, so therefore there's more dengue fever, and as a result there's greater mortality and morbidity. So there's really specific disease-specific aspects, but then there's also the issue of when there is any sort of basically extreme weather changes, floods, and how there's populations being displaced. Medics as well as any health professionals really have to deal with these type of issues, and they are happening. So that's why climate change is very much linked to health.
I mean, the science is, even though it's difficult to attribute specific events to climate change, but the science is clear. Like the frequency and the level of impact the extreme weather events have around the world is staggering, and it's increasing. I'm from Norway, but my parents are from Pakistan, and in 2010, we experienced one of the worst floods in recorded history. 20 million people was affected by a single flood. And the level of disease and level of disease burden that was put onto those people was staggering. And nobody can say that that is not a health concern or a health issue. So the health systems and the health community has to adapt, but also be the voice of climate change in order to give it a bit more human face, so we can try to form the public opinion.
Okay, so we started off talking about how medics can be very conservative, and medical colleges can be very conservative, where most lines of academia tend to do things in their time-honored way. How are you going to try and make sure that people do start seeing the parallels then, so that you have environmental scientists and developmental economists working together with medics, just to name three? How does one begin to start that dialogue? In this room, how do we begin to get people to talk to across disciplines?
Yeah, I think that's really a question for the audience, as you said, but we've seen some examples in the health community of interprofessional teams being created, at least within the interprofessional health community. So some medical centers will have social workers as well as nursing and pharmacy, and some will go a step further and have case management, people that are specialized on social work type of issues as part of the team. And I've also seen some countries, especially in South America, create these type of training camps where it's multidisciplinary, interprofessional camps, so where engineers and environmentalists as well as health doctors get together for weekends at a time and discuss the issues of their society and communities and how they can tackle that. So that type of dialogue has to happen at variety stages, like early on when we're training, but as well when we are actually practicing, and continuing to also not just stop there, but the research too. Many countries are driven by the research priorities a country sets. If we start creating research systems that are linked to multi-sectorial actions, and we incentivize that research, we incentivize our outcomes and our work according to multi-sectorial, then we'll see a bit more potentially multi-sectorial collaborations.
I have a question, actually. I mean, medical students are, in many parts of the world are championing this cause. Why cannot, doctors take the lead and take the baton from the environmentalist on this issue? Because we already know this. Why cannot doctors and current health professionals do that?
Do what?
Take the lead on climate change and take the lead on these interdisciplinary discussions or dialogues. Why does it have to be other people? I personally believe that we have to take the lead because we know the serious threat that are facing our patients. We know them. Why cannot we be at the forefront?
To put the human face on climate change.
Yeah, exactly.
Which you're very well placed to do.
Yeah.
Looks like people agree with
Okay,
that.
that's
here,
great.
But as we're going to discuss later on in the afternoon, there's been this big explosion of non-communicable diseases in the Western world, of course, but right round the world. 3/4, I think, of the deaths in 2010 were from NCDs. I may have got my numbers wrong, so forgive me, but it's very large. So how does one, when your daily reality as a doctor, the daily reality that you will face and many others in this room will face, is dealing with people who have hypertension or stress and the diseases of old age and cancer, and you know, you have to give the best care you can to an individual sitting in front of you. How can you then be thinking about climate change issues? How can, do you know what I'm saying? That it's a different order of magnitude of problem. Is it not?
I agree, but I would also like tend to see that those things are interlinked. It's not that we should preach to our patients about climate change. I'm not saying that, but I think we have to do it in a way that we try to explain, for instance, sustainable living, or let's say low carbon living, is good for NCDs. And the way you can put it is, I mean, if you use, especially in Scandinavian countries or in Nordic countries, the way you can put it is, if you use the public transportation system a bit more, if you eat less, consume less meat, that is good for the environment and that is good for you. So that can be like a concrete action. And we have many studies that show the co-benefits between health and climate change. And if countries agree to mitigate on climate change, like reduce their carbon emissions, how strongly it will impact on health in a good way, in a positive way. That's our message.
Okay, so major public health campaigns. But as we heard from Minister Maria Larsson, it's very hard to get people to change the way they behave, you know, to eat better, to be healthier. Public health education can get so far, but what are we going to do? Put hugely more money into that? Is that where we bet the future then?
Well, I think having a simple conversation with a patient for a few minutes doesn't require a lot of money. I think it's about, as much as we talk about tobacco cessation or any other topic, at least getting them to take a little bit more responsibility. And I think one of the things I haven't heard as much really come up is, where does the responsibility lie? We didn't talk about corporations, and I think that's a huge aspect that should be also brought up.
A question from one of our tweeters. Ashwani Rati, is it time to find a viable business model in global health that invites greater entrepreneurial involvement and investment? Perhaps I can throw that to you.
Okay.
Yeah, as far as like an entrepreneurial model for global health, I think we should definitely engage in global partnerships. But one of the things when we are entering into enterprises and collaborations, I think is still going back to the issue of responsibility, corporate transparency, corporate accountability. One of the MDGs was talking about global partnerships, MDG 8, I believe. And we didn't really end up getting into seeing how we do it because there wasn't ways to measure. So I think while it is an important area to explore, we still need to have more concrete ways to move ahead.
Yeah, I mean, okay, so let's just go back to what we're discussing in terms of the future development goals, or what's going to happen after post-2015. I think it will be absolutely crucial to see how we're going to use different stakeholders, not only states, in order to both make the agenda, but also implement it and watch it. And that's why global partnerships is so crucial. And young people have a major stake in that. And we have to claim that stake.
So, there are so many goals ahead post-2015. There are so many ideas laid out in front of us. What would you push? What's your one simple message to this audience, both of you? They don't have to be the same thing.
Okay.
Goals for the future.
Yeah, I think like our like message is kind of the same, and that is that if we are lucky enough to get one health goal, I think we will hopefully get one health goal. It should be based on the principle of universality. That is the key. And I think it was mentioned in one of the presentations, the concept of universal health coverage. Now, let's try to define that concept, and maybe we can put that forward as a health community in a goal, but not in a way that we're saying it's just the health system, but in much more comprehensive primary care way. Yep.
Yeah, and also going back to like access is really important, keeping the concepts of equity working in a multi-sectorial way and sort of really developing and making sure that we also do not forget the target populations, the vulnerable populations, and even topics such as NCDs, they all can fit into this. One of the things we notice is a lot of competition, and for us, we don't see the need for competition when we can work in creating and strengthening an approach and a goal that can deal with all of this, and I think we should challenge ourselves and really take on much more and challenge those that should be taking on more and are not. And I think as young people, or even at whatever stage we are, we can always have a voice as being part of our community, our society.
And a very powerful and articulate voice it is too. Thank you very much, Roopa and Usman.
Thank you.